Hello, my name is Valerie Cordero, and I am Co-Executive Director of Families for Depression Awareness. I am so pleased that you have decided to join us for our webinar, Navigating Teen Depression and Substance Use as a Family. Our presentation will last about 60 minutes, then our expert presenters will spend about 15 minutes answering your questions. We'll be pulling questions both from registration forms and from those asked live during the webinar. If you'd like to submit a question, use the question panel on your screen. We'll answer as many as possible. You are going to hear a lot of good information in this presentation. Feel free to download your own printable version of the slideshow by selecting the PDF file at the top of your screen. We ask that you fill out the online evaluation after the webinar. Your feedback helps us to plan future programming. Everyone who fills out the evaluation will be entered for a chance to win a copy of Amy Saltzman's A Quiet Place, a mindfulness workbook to ease stress and difficult emotions for teens. We have 3 copies to give away, so don't miss out. Please take some time to explore our website, familyaware.org, where you can find a downloadable teen depression fact sheet in English, Spanish, and now Portuguese, tips for supporting a person with depression, and information about how you can get involved with our incredible organization. If this webinar is helpful to you, please forward the link to your friends, family, and colleagues. The recorded version will be available for viewing through our website for a limited time. Lastly, we hope you will help us reach more families and help more teens by making a tax-deductible contribution to Families for Depression Awareness. Thanks again for your presence. We will now review the agenda. So I will spend another minute or two introducing our topic, and then I will tell you a little bit about our presenters before letting them take over. They will cover the prevalence of teen substance use, differences between substance use and addiction, and risk and protective factors that parents should be aware of. Then our presenters will spend some time reviewing the intersection of depression and substance use, the role you can play in prevention and treatment, and the importance of involving teens in decision-making. We will conclude with some information about the resources offered by Families for Depression Awareness and the Q&A with our expert presenters. As we prepare to hear the valuable information that our presenters have to share, I would like to remind you that just by being on this webinar, you are taking a vital step that will help you to prepare to better support a teen's mental health. On this slide, we reference a really great study that came out last year. It was by the University of Michigan, and they looked at a group of young people who had previously had a suicide attempt and been hospitalized. And for some members of that group, they gave regular standard care. And for others, they gave standard care, but they also allowed the teens to identify a caring or trusted adult who would receive psychoeducation and suicide prevention education. What the researchers found was that the group of teens that were able to have a trusted adult receive psychoeducation, those teens were more likely to be alive 11 to 13 years later. So that was a really, really important finding, and it really reiterates the fact that psychoeducation and learning about mental health really does matter. For those of you who may still be wondering, why are we talking about substance use and depression together, I'd like to read one of the statistics on this slide to you. Approximately 30 to 45% of adolescents with mental health disorders have a co-occurring substance use disorder. In other words, mental health and substance use disorders can often go hand in hand. We're going to cover substance use in this webinar, If you want to learn more about depression in teens, I encourage you to go to familyaware.org/teen webinars and watch our training called Understanding Teen Depression. It has some really great basic information that will help. Now it is my great pleasure to introduce our presenters for this presentation. David Blair has been co-owner, co-director, and family therapist at the Denver Family Therapy Center since its inception in 1988. He co-authored Youth and Their Families, a guide to treating adolescent substance use through family systems therapy, which was published in 2019. Jamie Blair Echevarria is a co-owner at Denver Family Therapy Center and the clinical director for the Adolescent Substance Abuse Program and the Youth Drug Alcohol Prevention Program at the center. Ms. Echevarria has 18 years of experience working with adolescents and their families. And it's so appropriate to talk about families because David and Jamie's father and daughter, so you all are well representing families this evening. So Dave and Jamie, the floor is now yours.
Thank you, Valerie. I appreciate that introduction, and thank you for clarifying that we are, I guess, daughter and dad, which is, you know, a good clarification because people often think we're married to each other, and I need to clear that up for folks. So thank you. Yeah, I'm really excited to talk about adolescent substance abuse and some of the ins and outs in our program tonight. Okay, so the first place that I'd like to start is talking about prevalence of adolescent substance use. The most widely used substance among adolescents is marijuana. It's referred to often as THC, which is tetrahydrocannabinol, which is the active ingredient that makes you feel high when you're using marijuana. So that is the most common drug used by adolescents. And it's the most common substance that we see in our treatment program as well. For this slide, I'm referencing a study called the Monitoring the Future study, which is done yearly, and it asks about use patterns and perceptions of substance use among adolescents in three categories, which are 8th graders, 10th graders, and 12th graders. And so for this slide, I'm talking about the most recent study results that have come out, which are the year from 2018 to 2019. And what we saw in that most recent year is that marijuana use went up in all three categories: 8th graders, 10th graders, and 12th graders. And among 12th graders, about 36% of them report using marijuana. More concerning, or equally concerning, I suppose, but new, is the method of using marijuana through vaping. Also, adolescents use vaping to smoke nicotine as well. But this is something that has made a big jump in the last year, almost doubled, that between 2018 and 2019, vaping use has gone from about 7.5% of adolescents to close to 14%, which is a great big jump. And just to give some comparison there, 12th graders who reported daily vaping use was about 12%, and that is compared to 12th graders who reported cigarette smoking is at 2.4%. So you can see it's a very large difference. So we're making some really good progress in reducing cigarette usage among adolescents, but now we're concerned about adding vaping as a new way to smoke, and adolescents will use vaping to smoke both nicotine and marijuana. There is some good news, however, and that is overall drug and alcohol use is actually down. It's down in almost all of the categories. And a couple that I want to bring our attention to include opioid and alcohol use. We've been hearing a lot about opioid use in the media regarding heroin and other painkiller use, particularly among young adults and adults. But among the adolescent population, from 2003 to 2019, opioid use decreased from 10.5% to 1.1% in 2019. So that's a large reduction and really good news about using painkillers, opioids, heroin, things along those lines. Alcohol use is also down in all three categories: 8th graders, 10th graders, and 12th graders. All three categories report reduction in drinking, both regular drinking, meaning kind of every once in a while drinking, as well as binge drinking, which is, drinking a lot of the substance at once. Okay, so I want to talk a little bit about what is substance use and how do we define that. First, I talk a little bit about the term addiction, which is kind of the term that you hear most often. And I bring attention to this because this is actually, we find, not as helpful of a term when it comes to talking about and treating substance abuse, particularly for adolescents. However, that is, the definition there is that addiction occurs when substance use becomes compulsive, chronic, out of control, and takes place despite harmful consequences. But what we know is that, substance use really exists much more on a continuum. And actually in the DSM, the Diagnostic and Statistical Manual, which is the manual that mental health professionals use that guides diagnoses for all sorts of areas, doesn't even include addiction in there. It includes the term substance use disorders, or SUDs, which are characterized by impairment caused by the recurrent use of alcohol or other drugs. And this, again, happens on a continuum. So this is important because adolescents are in a stage of life where they're experimenting and they may even be using substances in unhealthy ways, but that may not necessarily mean that they're experiencing addiction. And so substance use can occur kind of from a mild place to a severe place. And some use is still considered within the normal limits of adolescent behavior. So to address the question of why adolescents use, this is an important question, and it also has some pretty logical answers. Adolescents use for some reasons that I think most people would probably be able to guess. Number one, it feels good. They like the feeling of being high or drunk. Usually that feels like fun. It's a new experience. And secondly, they enjoy the peer acceptance that they perceive as something that goes along with the substance use. Often there's a perception that their peers are using, and in order to kind of feel like they belong, they might want to use, and they're rewarded by doing that in a social atmosphere. Another reason, which is related to the issue of mental health and depression, is that sometimes adolescents are using in a way that serves a function for their life, which is to help cope with or manage negative emotions such as stress, anxiety, or depression. And this method or reason for using is particularly concerning because this is the time when adolescents are most at risk for developing what we refer to as psychological dependence, which basically means that they become dependent on using the substance in order to manage psychological stressors. And instead of practicing and learning to develop other healthier coping mechanisms. Adolescents are in a particular developmental stage, and they are primed because of this stage to take risks and feel invincible. This is something that most people understand. At the same time, what's important to note is that their brain is going through significant development, and some particular development is happening in the prefrontal cortex. And on the slide that we're looking at, this is the section that's highlighted in purple in the front of the brain. And this part of the brain is responsible for helping develop higher level cognitive functionings like decision making, planning, forward thinking, moderating behaviors. These are your inhibitions, personality expression, as well as emotional regulation. And so this is an interesting time because adolescents are going through these two processes simultaneously. They're needing to take risks to develop their sense of self. They have this belief that they're invincible, that bad things happen to other people, they don't happen to me. And at the same time, their brain is learning how to manage the negative things that might happen, stressors that happen, relational issues, and essentially trying to have good judgment and thinking ahead. And so it's interesting because the same reason that they might want to use is part of an impact of the fact that their brain is developing in this particular way. So again, this is a high risk period of time to use. I think of this kind of like the example of using a calculator to do your math homework before you really understand the concept of the math problem you're trying to solve, right? So using that calculator early on gets you the answer quickly and you feel good that you've completed your homework, but you don't really know how to solve that problem. You don't have a full understanding. And that's kind of the impact of using drugs and alcohol as a method to manage your negative emotions. You manage them in the moment, you feel better, the stress might go away, you're able to relax, but you haven't really developed any actual skills for managing and struggling through negative emotions and learning other coping skills. Okay, I'm going to turn it over to my dad, and he's going to talk about risk and protective factors. I'll continue changing the slides, so Dad, let me know when you're wanting me to make a change.
All right. Thanks, Jay. That was pretty good. Set me up well. And thank you for moving the slides. You know, I'm the older generation. I tend to screw that up, so I've accepted that and turned it over to this younger generation. But Jamie definitely does not want to be known as a millennial. She's older than that. So anyhow, let me move forward here. I'm going to talk about risk and protective factors for adolescent substance use. These concepts come out of actually kind of prevention research. You know, we spend a lot of time trying to find out what are the factors or the precursors, the contexts that seem to increase the vulnerability or increase the risk of developing substance use disorders. And alternately, at the same time, we want to know what are the factors that seem to decrease the vulnerability or the development of substance use disorders. And so one of the things that I think about a lot is how the importance of family in this process of preventing and doing things that can make a difference to help mitigate the risk of developing these substance use disorders. Or you can apply these concepts to mental health issues as well. But when I think about family, I think of family it really has two primary functions, the basic level. I like to think of it as the families their job is to simultaneously protect and prepare. We're protecting our kids from the risks inherent in the communities and the families and the relationships that we have. As young children, I think of it as like kind of a cocoon. They're in there. They're not exposed to the risk. Our whole job is to kind of protect them. But as we're protecting them from all these risks and dangers, we're simultaneously trying to prepare them to protect themselves. It's a crazy job, this parenting. And parenting, by the way, that sounds traditionally like mother, father, but families have all different forms of parenting. It can be, the role of parents, of grandparents, of older siblings, of, aunts and uncles. We see lots of varieties of families. But just for the sake of this discussion, to keep it simple, we'll just be talking about parents in general. Basically, it's a tough job. It's a bit of a little conundrum. We're protecting them, but then also preparing them to protect themselves. How do we prepare them to protect themselves? Well, we slowly and systematically expose them to risk and have them practice that. And if they fail, they do it in the context of our safe little nest here. But as adolescents, as they enter adolescence, then it's inevitable. The older they get, it's inevitable that they're going to be exposed to these risks that we are not there to protect them from. So we're hoping that they can internalize these things that are happening for them so that they're prepared to manage these risks. It's an interesting little dilemma. Too much protection. This is what it's really a balance thing that we're really trying to develop here. But too much protection can mean that they have not learned to protect themselves. They haven't had the experience of successfully managing risk. And then having that, receiving approval from their parents, saying, you've done it, you're doing well, you can do this. And alternately, if there's not enough protection, if we throw the kids to the wolves too soon, they're certainly vulnerable to these risks. And the risk we're talking about in this presentation is the risk of developing substance use disorders, of developing relationships with substances which are damaging and affecting our health and all those things that Jamie talked about. So when we think about these risk and protective factors, you think about them as kind of opposites or mirror images of each other. We tend to think of them, categorize them at several different levels. There's individual risk and protective factors. There's family risk and protective factors. There's, peer, school, work, that part of their world, risk and protective factors. And there's risk and protective factors that exist at a societal and kind of cultural level. So I'm going to try and kind of break it down that way just for the sake of trying to understand this. So on an individual level, there is, Jay, let's see, I lost you. Do you have sorry guys, I lost my, there we go.
You want me to forward it?
No, there we go. Now it's up. It went away. I apologize, folks. At an individual level, this has to do with, I wanted you to forward it to the next slide. There you go, that one. People have genetic predisposition or hereditary factors that we're just kind of born with and are part of us. And these represent both risk factors and protective factors. But the most common way to think about it is that we, like this slide talks about 30 to 60% of people, that's a wide range, with substance use disorders have a hereditary vulnerability. There's been 2 or 3 generations of substance using in their family history. That's a thought about hereditary. It's handed down. When we have 2 or 3 generations of substance use in our family history, that means there's going to be an increased risk. We have increased vulnerability to become dependent on substances. Doesn't mean just because it's there that we will develop substance use disorders, but it means there's an increased risk. Just the whole developmental cycle, which is a natural cycle that's going to happen regardless of what happens in the context, is that as children grow up and enter adolescence, that's a time when, for many different reasons, they are attempting to kind of disconnect from their family and connect to the outside world. So that, just adolescence itself, entering adolescence, is a risk factor, right? And the protective factor related to that is that they have been in a family setting that has helped prepare them for this. That's what's happening. That's how we set the table for them to get out there and be able to successfully manage the risk in a safe way. A common thing that comes up often now, I kind of move into the family factors. I think you can go to the next slide, Jay. The family factors is this issue of what about when parents, whoever's in that role, are substance users, and is that a risk or protective factor? And that's interesting in that it appears that yes, it increases the odds. If you are modeling alcohol or pot use with your kids and they're watching you do that, that kind of reduces the idea of perceived risk, like it's being normalized in their eyes, and that will increase the odds of them developing a substance use disorder. I mean, that seems to be true. Now, on the other hand, the fact of the matter is probably 80% or more of the adults in our particular culture use some kind of substance, most likely alcohol, and of course, as you can see, the use of marijuana is increasing and becoming more almost a drug of choice for people that have grown up in the culture over the last 25 years. So the odds are that you are going to be able to, that you will be drinking or using weed. But if you are doing that and doing it as parents in a responsible way, if you're setting limits, if you're modeling a healthy respect for this, and you're saying to your kids, you're not ready, we're not approving of this for you because this is a risky substance and it needs to be done in a controlled way, in a way that doesn't interfere with your education, your relationships, your work life, all of those things. And you model that you're going to do that. This would be our functional user, and it doesn't affect them. That can be a protective factor. So you're teaching them how to have control and respect the risks involved in substance use. So hopefully that makes sense. The fact of the matter is a lot of people that are in drug treatment, in fact, they've done some studies, adults that end up in drug treatment centers or hospitalizations or rehab centers, maybe 50% of them report that they came from a family where there's a history of substance abuse. But another 50% report that there wasn't a significant or any alcohol or substance use in their family of origin. So that's just an interesting thing. It's just using as parents increases the vulnerability, increases the probability of a kid being vulnerable to substance use, but it doesn't necessarily mean that it happens. The thing that seems to matter is the structure and the boundaries and the communication with the child about the risks and rewards and responsibilities of using. So anyhow, I was just thinking, going back a little bit to the individual factors, it's interesting that being male is a risk factor for substance use, developing substance use disorders. What that means is the very large percentage of the kids in treatment are male. That doesn't mean females don't develop substance use disorders. They certainly do. But there's something about being male that is a risk factor. And we think it's because of the way our boys are socialized to kind of be independent and separate, and to somehow has something to do with competence and the peer rewards and all of that stuff that are more important. I don't know. There's 100 reasons. Some people say it's testosterone and that we're kind of conditioned to take more risks and be sensation seekers and that sort of thing, which very well could be, but it just is a reality that's how it is. Interestingly, for mental health, for depression specifically, that being female is that's a risk factor, because the majority of the kids that are suffering from major depressive episodes tend to be female. Why is that? I don't know. Socialization. You all can have theories that females tend to respond more emotionally rather than behaviorally to the stresses and the risks out there. But that's a kind of a stereotype, that there's maybe some validity to that. But I'm just trying to give you an example of all these things are variables that coming together represent risk and protective factors. In the end, our hope is that there's going to be when we finish counting them all up that people are facing, that there's more protective factors and risk factors. That's kind of the way it is, because the risk factors exist everywhere. The more kind of family risk and protective factors are things like, let's see, before I go there. Yeah, Jamie, go to the next slide. These are things that now that families can do to kind of help support these protective factors, or create protective factors. But they're also, family can become a risk factor depending on which way they go. But if you look at the characteristics of some family protective factors, stuff like religiosity, that just means that the parents and the children together are participating in some kind of spiritual, religious thing, organization. These are that they create, because these support pro-social, pro-health values. They support honesty. They support doing, honoring your family. They support all of those things. And so those become protective factors for kids when they are in the place where they're going to start stepping away from their family and having to face these risks that are coming at them. There's, having kids be involved in pro-social activities. And this has to begin as soon as you can. It has to become part of their world. It's not something you can kind of plop a unhappy kid in and think that that's going to make the difference. These are things that are kind of baked in over the years as you are involved with them. So, famous ones are sports activities, but it doesn't really matter. It has to match what the kid's natural inclination is and your interest as well as parents. So activities like athletics, scouts, peer, special peer groups, artistic events, something that's going to really accent and help their development of what their natural strengths are. These are all activities and things that you're involving them with because it gets them involved with usually a positive peer culture that understand that drug use will interfere with their goals and their values and that kind of thing. Now, you can understand that the risk factor around peer issues is if kids are with drug using or substance using peers. If that becomes the group that they are identifying with, well, that becomes a risk factor. Those kids end up having a much higher probability of becoming involved in substance using. Parents' involvement with these, it's not just the baseball team, it's the parents' involvement, the parents' presence being there. And and not necessarily being the coach or being too involved, because then doesn't belong to the kid, but being involved in a supportive way. The kids in those activities, whether they're doing a performance or playing a game or whatever they're doing, this is how they're kind of developing some competencies. But what really helps them is to look out there in the crowd and see that there's a parent or somebody that they really trust who's there supporting them and proud of them. That's important to their development. So this involvement and connection with them, parents, this whole concept of connection is a protective factor. Try to find ways to be connected with them in a positive way. Involvement with school, involvement with their peers, knowing who they are. Those are all protective factors. Risk factors are that's a whole separate world that parents aren't involved with. And what's happening is that they're connecting to this other group and disconnecting from their parents. And they need that connection from their parents. They still need that. They're kids still, and so they still need protection. Protection comes in the form of setting limits, having realistic expectations, making sure that they know what is safe and what isn't safe. It usually is in the form of setting limits and structure for them. Taking a strong position about we do not approve of drug or alcohol use because it's dangerous to your health. It's dangerous to your development. And we want to kind of model a healthy relationship with a healthy kind of perceived risk towards drugs and alcohol. Those are all things that happen through. Yeah.
Dad, can I interrupt you quickly? I'm
Sure.
just keeping an eye on time, and I think we probably need to move forward to the next section. Sorry to rush you, but I want to make sure that we have a chance to get it all in.
Hopefully you're all getting the idea. The importance, the biggest protective factor is your involvement and your connection to youth in all the different areas that they're interacting. So that's what I'm trying to emphasize here. Maybe to finish up, there are some other protective factors that are outside of the family. These are things like what happens with laws and limits that exist in our community, like laws about age and possession and all those things. Those are protective factors that help set some limits and reduce the availability and reduce the opportunity for kids to use. That would be a protective factor. A risk factor would be what we have going in Colorado when there's, legalization has changed the perception of harm that kids have. So that's had an impact on increasing the probability of them developing some substance use disorder. That's an example of how laws and that level of structure is helpful. And same thing with media is they're barraged with media images through songs and movies, etc. And that on their social media and Facebook and all the stuff that they're doing, they're seeing lots of stuff on there that suggests that it's that drug use is positive and will help them. There's a risk factor there, but social media and media in general can also be a protective factor by educating and talking about it and informing people of what the outcome is. So these are influences that we're always dealing with. And I guess I recommend that as you're hearing those things, I love talking to your kids about that and what all that stuff means to them. Being able to communicate about drugs and about use and what their thoughts and beliefs are and the thoughts and beliefs of their peers is a protective factor. So I think what I'm going to do is just move on and talk for a minute about this intersection of depression and substance use. Our primary focus in this is substance use. But if you move to common features, Jay, that slide, we like to think about this, and this is consistent with what we're saying to you today. There's this saying that addiction is the opposite of connection. So what this essentially means is that if our kids become over-involved or dependent on drugs or negative peers or whatever it is, and that means that they're going to disconnect from parents. And you parents are the biggest protective factor, your connection with them. And just because they're 13 or 14 or starting to act like they don't want you around, they do. And it's going to be very important that you maintain a connection with them and be part of their lives. That's the biggest protective factor. If they're connected with you, there's going to be less of it's going to reduce the probability of them attaining one of these substance use disorders. That's the moral of the story, is your involvement and your connection. Let's go to the next one, Jay, the intersection of depression and substance use. That little chart that we've been looking at. We don't really have a great way to understand this. I think it's kind of like a Rorschach. You can understand it in any way that you want. But if you look at this slide, you can see in 2018, for example, kids between 12 and 17, the big blue circle represents all the kids that had a major depressive episode in that year. There were a total of 3.5 million kids. And I think they get those through SAMHSA and all these other big National Institute of Health, and they do all these surveys, and that's how we know that number. So there's about 3.5 million. You can see that the yellow circle are all the kids that had a substance use disorder. They probably were entered into treatment or somehow they got identified as having substance use disorders. So obviously the number of kids that experience these major depressive episodes, which by the way is defined as if a kid had at least one period of 2 weeks or longer in the past year when they experienced depressed mood, loss of interest or pleasure in daily activities, accompanied by problems with sleeping, eating, energy, concentration, and self-worth, classic symptoms of depression. So you can see that it's actually a much larger issue with our kids than actually substance use. Just because you have a depression is not necessarily there's only like a 13% chance that if you had a depressive episode that you also had a substance use disorder, is how you want to read that. Whereas the yellow, where it looks like, well, it's a little less, but you can just guess about half of the kids who had substance use disorder also had a depressive episode. So you might say that substance use is a risk factor for depression. And that kind of fits with the idea that kids will sometimes use to manage their mental health issues, their depression, their anxiety, that sort of thing. It's and that substance use or mental health, meaning depression, is not necessarily, it's a low risk factor, it's a risk, but it's a lower risk factor for getting a substance use disorder. So anyhow, it's just an interesting way to look at the intersection of these. This whole idea of risk and protective factors, reducing the probability, creating environments that help mitigate the risk, helping our kids learn how to protect themselves. Those are kind of true for both substance use and mental health and other and depression, anxiety, and other mental health disorders. So anyhow, I've talked enough. Jamie, take it away.
Okay, thank you. I'm going to go ahead and start talking a little bit more, well, actually not a little bit more. This whole thing is about family and parental figures for adolescents using substances. And so like you talked about, parents are doing a big job of providing safety as well as preparing their kids for independence in the world. And so generally speaking, I think this requires that we acknowledge a few kind of basic premises of what that probably means for families. And so we kind of talk about these here in the slide. The first one being that it's really important that parents are comfortable with and are okay taking charge and being in charge of their adolescents. We feel like oftentimes families worry about how their kid is going to respond to setting limits or saying no or taking charge, that they might get angry, they might feel sad, they might be unhappy, might make you unpopular, something along those lines. But it is important not to let the adolescent kind of interrupt your ability to stay in charge, and so not being afraid of your adolescent. Secondly, you're going to make mistakes. All parents make mistakes. That's an inevitability. And it's just really important that, I set the expectation up front as we talk about this, that I've never met a parent who has intentionally done something to harm their kid. But sometimes as parents, we make mistakes. I'm a parent, I make mistakes all the time. And so the point here isn't to pass judgment. It's about trying to help each other support and move past those mistakes that are made. Talk about it with your kids, own up to it sometimes, and just understanding that guilt doesn't really do much to keep your kids safe. So it's not, it's an inevitable feeling, parent guilt, but it's not a particularly useful experience in terms of parenting. And the other last one here is that the adults in charge need to be able to support one another. And this could go for a lot of different types of family situations. If you have a two-parent household, then both parents need to be able to support one another in terms of presenting a united front to the kids and regarding what the expectations are, what the limits are, and how people address those issues in the family. But it could also apply, and definitely applies, not could, it does, apply to families who may have blended family situations, and maybe there's parents and step-parents, or potentially multi-generational households where parents and grandparents are helping raise kids together. And so it's important that whoever the adults are in the system are trying their best to work together. That doesn't mean they have to be perfectly in lockstep with one another, but they do need to have a general agreement about what the expectations are and what the limitations are as well for kids. So talking about primary prevention is something that starts at home. It is, important to kind of reiterate what my dad said about, even though kids sometimes give off the idea that you're not, their favorite person all the time, they're trying to individuate, become more independent, they're pushing limits. That does not mean that they don't need you, and they still are watching you. They're still looking up to you, and still are looking to you to set what the standard is and the limit in their life. And so it's important that parents model appropriate boundaries, practice open communication from an early age. I think my dad talked about that as part of a protective factor, but the sooner you start talking to your kids about all things, but including substance use, the more you're setting the stage for them to feel safe talking to you about those subjects later in life when that becomes a reality in their own life. And this is true not just for substance use, but sex and relationship issues and all the things that, kids will encounter as they get older. Keeping appropriate boundaries combined with that ongoing communication will let your adolescents know that they can trust you and that you're reliable. And I like to remind people that one way to build trust with your kids is doing what you say you're going to do. And if you say there's a limit and then you follow through with that limit, even though your kids might feel like they don't like that limit, that's still a trust-building experience because they trust that you say that you're going to follow through with the things that you say you're going to do. So something that is important as we talk about entering treatment is, again, the value of the role of the parent in that treatment process. And so, talking about when it's time to bring in an outside member to help, right? Deciding whether or not to engage in treatment. In that process, we want parents to continue to remember that you can still be in charge, that you can ask questions throughout the process, and that treatment should be a collaborative effort between parents, family members, and the providers, the treatment providers that you engage with. And just like it's important for parents to present a united front, it is equally important that treatment providers and families together are trying to present a united front, and that helps treatment outcomes. Experienced family therapists will respect and invite family involvement and will see family members as partners in the treatment process. Okay. We'll talk a little bit about treatment specifically. And first of all, we'll talk about some signs that it might be time to get help. Basic signs are that, you notice some changes in your adolescent, maybe their behavior, their moods changing significantly. Another example is that maybe you notice that changes in their level of activity or involvement in things that they once were more involved in but are suddenly losing interest. That could be school, sports, music, whatever it is that they love and have enjoyed up to this point. If they're suddenly starting to disengage, lose interest, that could be a potential sign too. Other signifiers might be significant, like personality changes. You start to notice that your adolescent is behaving in ways that seem uncharacteristic. Maybe they start to isolate. Maybe you notice a change in their friend or peer group, conflict within their close friendships, or potentially increased conflict at home because suddenly they're not, respecting boundaries that have up to that point been respected. So if some of those things are happening and you have made attempts already to connect with your kid, address some of those concerns, and your adolescent isn't responding, that might be a time to consider looking for some extra help from an outside treatment provider. So some recommendations when you're searching for treatment we recommend is looking for a therapist that is licensed in both mental health and substance abuse practices. So mental health licenses include clinical social workers, licensed in marriage and family therapists, and licensed professional counselors, LPCs. Those are all the mental health licenses, and somebody who has experience and training working with substance abuse are referred to as certified addictions counselors, and they have ranges from levels 1, 2, 3, and a licensed addictions counselor. We recommend that if you're getting treatment from someone with a CAC, that they have a CAC 2 or higher, which just means that they have enough practice, supervision, and can work independently with your family. Also, it's important to look for a therapist who understands the reciprocal and co-occurring nature of depression and substance abuse. And by that I mean substance abuse can reinforce depressive symptoms, and a sense of depression can lead to potential substance use. So they both have the opportunity to reinforce the other, and so they go hand in hand. And so it's important that providers treating kids with co-occurring disorders understand that and feel comfortable working within those confines. And then finally, safety is an important determinant for what level of care that you might be seeking for your adolescent and for your family. The first stage of finding treatment is typically getting an evaluation. And during an evaluation, it's important that the provider try to get a very whole context, a broad picture of your family. And so this may include understanding family history, child development, school performance, peer relationships, life stressors, medical history, all of those things and much more are involved in an initial evaluation. This is really important so that the provider can make an appropriate recommendation that indicates what level of treatment that might be most appropriate for your family. So levels of treatment range from what we call outpatient all the way up to residential treatment. Outpatient means that maybe you're seeing a therapist once a week or once every couple of weeks for either individual or family therapy. It could also mean that there's treatment with medication that comes from a primary care physician or psychiatrist. And then the treatment levels can go all the way up to residential treatment, which is, kind of the rehab idea, meaning that the adolescent needs to be placed in a facility where the environment is controlled. They can establish stability and get treatment. Typically that lasts for a month or sometimes more. And then there's everything in between. Day treatment is a level of care that is kind of like going to school. Kids will go for a day, maybe like 8 to 5 or 8 to 3, like a school day. They'll get some education and they'll also get mental health services throughout the day. Intensive outpatient therapy is a level of care that for adolescents ranges from 6 to 9 hours per week. Traditionally, that's like 3 days a week, 3 hours a day, and is a combination of individual and family therapy and group therapy. And then hospitalization is used primarily when there's a more urgent need for stabilization. This would be a crisis situation to need to hospitalize your adolescent, maybe because there's violence, there's a feared overdose, or potential suicidality. There is some resources, I believe, being handed out to those of you who are here with this webinar with further information should you need to access crisis services. Okay. Talking about the question of getting adolescents to engage in treatment. This is always creates a lot of questions, and it's important to understand that part of being an adolescent means pushing boundaries. Oh, I see that we're starting to run out of time. I'll move quickly through this. So they'll push boundaries, and it is important that we understand that that's normal. It's normal for kids not to really want to engage in substance abuse treatment. It is more normal for adolescents to care about something that's important to them, like feeling better, maybe improving relationships in their families, and or improving peer relationships, school performance, or potentially getting out of trouble if they're involved with the legal system, or they have a probation officer, maybe they've been suspended from school, something along those lines. Some kind of do's and don'ts that I'll talk about quickly, and then perhaps we can answer some of these in questions, is that it's important to involve your adolescents in finding a treatment provider. Often the family members, parents need to take that lead on that, given that the kids are less motivated for doing that type of work. And keep your teen involved in that conversation. The more they feel involved and the more they feel their voice is heard, the more likely they are going to be to engage, and the more likely they're going to have a positive treatment outcome. Be honest with them. Don't trick them into coming to a substance abuse evaluation. Leave it to the therapist to manage their unhappiness about being there. If they feel lied to or duped, that will make it much harder to engage them and impacts treatment outcomes in a negative way as well. And then finally, it's important to try to meet your adolescent where they're at. If they're motivated to get out of trouble, but you care about them getting clean, let it be okay that you start with them getting out of trouble. We know from a therapy perspective that eventually that leads to them needing to get clean as well. Okay, I feel like I should probably stop here. Valerie, correct me if I'm wrong, but we can go into some of the other things if they are involved in questions. Is that okay?
That is fine. Thank you so much to both of you, Dave and Jamie, for that wonderful presentation. We're just going to remind you that depression and substance use, they don't define you or your teen or your family. Be kind to yourself. Practice good self-care. We're going to spend just a couple of minutes talking about the resources that Families for Depression Awareness offers, and then we're going to go right into question and answer. So if you have not submitted your question yet, if you have other things you want to talk about, please, this is a great time to put those questions in, and we're going to go through as many as possible. So, Families for Depression Awareness, our mission is to help families recognize and cope with depression and bipolar disorder to get people well and to prevent suicides. We have a lot of great programming for families, and most of it is free. So we are able to offer things like our teen depression program. That is a great program through which we have trained over 30,000 people, and we have lots of different offerings through that program. Other webinars like the one that we are on today, teen speakers. We have our Instagram account for teens. So please look at those, and you can find all that information on our website. That's actually our next slide. Our website, which is familyaware.org, is the hub of so many of our wonderful resources. You can find other webinars. We have web tools such as our family tree. You can create a family tree on there. We have a depression wellness analyzer. We're also really proud that we can offer some online screening tests. The PHQ-9 and the MDQ, those are depression and bipolar tests, screening tests, I should clarify, it's the same thing you would find in the doctor's office. You can take that same test online on our website for free. We have a brand new caregiver stress test based on the perceived stress scale. And we not only offer that screening for free, but at the results, when you get your results of your stress level, we offer some great resources that'll help you take that information and do something about it. We also want to mention that we have other free webinars. Please look at our trainings page for links to some great series that we have on adult depression, on bipolar disorder. We did a great series on insurance. We also have some wonderful family stories and expert interviews on our website. We hope that you go there and you'll read the stories of real people who've gone through some of these issues and are not afraid to share their stories. And so that can offer support and examples of how other families have gone through issues. We also want to mention that we have some wonderful publications, and depending on the program that they're associated with, we often do give those away for free. You can also purchase them if you're looking to have them in bulk for your school, for your office, for your workplace. So you can find our publications on our website. We also want to make special mention of our teen resource cards, which you can buy to customize. They are wallet size. They fit in a teen in the back of their phone if they have a little phone case, and they describe depression symptoms and how to get help, and it's all in language that is accessible to teens. They were created with input from our teen volunteers, and you can customize these by putting your school logo, resources in your community on those cards. So we really do encourage you to look at those, and again, you can purchase those for your school or for your community, for our health department. So we encourage you to do that. Before we get to question and answer, which I promise is coming up next, we want to say a special thanks to our presenters, David Blair and Jamie Blair Echevarria, and to the wonderful funders that support our work. We have our corporate member Gene site that is listed there, and also the great support of George Harrington Trust, Rebecca Pomeroy Foundation, Thomas Anthony Pappas Charitable Foundation, Bennett Family Foundation, Adelaide Breed Baird Foundation, John Donnelly Trust, I Am Strong Foundation, and of course, we can never, ever, ever forget people just like you who believe in our work, believe in our mission, and support us through their donations. So if this presentation was meaningful to you and you want to support our work, you can make a donation, tax-deductible donation to us at familyware.org. And now, without further ado, we are going to get to the part we know that you all are waiting for, which is question and answer. And as I said before, we're going to do a mixture of questions that were submitted ahead of time and your live questions that you have asked this evening. So we're going to start with a question, Dave and Jamie, that was submitted ahead of time, and it goes like this. What do you tell someone who abuses substances, and of course we're talking about teens in this case, to deal with their anxiety or depression, and says that that's the only thing that seems to work for them? What do you say, or how can you talk to a teen who says, this is what works for me to help me?
So I can jump in and talk to that question a little bit. I think in my experience, one of the things that I often will talk about with adolescents who have that experience is just to patiently ask them about how well it has worked, what the outcomes have been for them in sort of managing their anxiety or depression, whatever the case may be, and also exploring times in their life prior to when they started using substances as a method to manage their anxiety. Almost all of the time, adolescents have some exceptions to that rule, and so it's just about making them feel heard. Typically, when they're saying something along those lines, it's because they're just feeling so desperate to manage the emotion, and so giving this time and space to hear them out completely, validate their experience, and then work together to offer some alternatives, talk about models they've seen of other people managing, practicing some of those managing techniques in sessions, and also tapping the resource of their family who, have experience, wisdom, and know their kids well to kind of give some insight on that also.
Let me just add, Jamie, it's interesting because when folks are telling you that, one of the things that you have to be able to assess is that just a justification for getting high, and that's how they're resisting us. But there are some folks that do report that getting smoking pot does help them with sleep or anxiety or even depression. And so, with adults, this is a problem we got here in Colorado. We got the whole medical marijuana place that is supporting the use of pot for treating medical and mental health disorders. So it's kind of this is one of those risk factors that impacts our ability to deal with that. But I think we can, with kids, I think we need to take the position that they're not ready for that kind of medication at this point in time, and just say that's you're going to have to find another alternative, and let me work with you to find some other ways to manage that are healthy and that are safe for you, and not let up on that. We got to believe that. So that's how I would deal with it. Go ahead.
That's a great point. And then keeping those, as you were saying, keeping those lines of communication open. And there's another question, and we did not get to go over this section in the presentation because we were running short on time. So we definitely want to address this question now. What is your recommendation? This is a question from one of our listeners. What is your recommendation to parents when they can't get their kids to go to therapy? That was part of, I think, some of the later slides that we didn't get to. And, that is a situation that does happen. It's not the most common, but it does happen. And this is the time that, parents are kind of put in a position of really cashing in their parent in charge card and need to take a strong stance and include other important people in the adolescent's life to support that stance, that treatment may not be an option. I think continuing to communicate about it is critically important. Again, all of the other tenets apply about being honest and all of those things, but it may just have to come down to parents saying, this is not a choice, and beginning to leverage some of the things that they have at their disposal in order to push for their adolescent to engage in treatment. Often this could mean something like, leveraging special privileges that adolescents have, like driving or earning money or being able to spend time with their friends, having certain freedoms within the family. Also, if adolescents are using at, a higher rate, they're doing more extreme things, there's also a likelihood that they're at risk for becoming involved in the legal system as well. And although that's never an ideal situation, if your adolescent is involved in the legal system, for instance, a probation officer or a diversion officer, or even just having court, set up, in the upcoming weeks or months, can be a powerful point of leverage, and parents may need to utilize those things in order to make their kids go. So in our treatment program, we have an intensive outpatient program, and so we often have kids involved in our program who are involved in the legal system. And when it comes down to it, sometimes we do need the extra push from a probation officer, or we do need the parents to say to their adolescent that either you go to this treatment program, or I will let the court know when we attend court in 2 weeks from now that you are not following our rules, you're not being safe, and I will ask the judge to order you into treatment, or I will let your probation officer know that you're not following through, or something along those lines. If it is severe enough that the adolescent is
not safe and cannot be controlled or cannot be coerced, I suppose, into going into treatment on their own, it is possible that that might be a situation that calls for more emergency services. And if you're afraid for your adolescent because they're actively high, or you fear that they're withdrawing or overdosing or something along those lines, that would be the time to access emergency services.
Okay,
Yeah, I want to just support.
Great. Yeah,
I want to say
Jamie.
something about Jamie's. I think that that this is where this issue of parents have to protect their kids. So if they are behaving in a way or in a way that is out of control or risky for them, then we need to say that you don't have a choice. You are acting in a way that's not safe. Whatever it might be, behaviorally, emotionally, and we're going to make sure that you get some support and help with this. If you don't think there's a problem, that's a problem, and so you are going to go. The only thing will get you out of going to treatment is that you make the changes that you know need to happen. You haven't been able to do that so far. So, I just think it's a determination, and like Jamie says, pull the parent card. This is your job as a parent to do that. You need to protect them at that point because they're not protecting themselves. So,
thank you. That's very helpful. We got a question both submitted live and a couple that were submitted ahead of time from people who are not the parents. They are in a teen's life who is dealing with substance use and mental health, and they don't know what their role is. So what do you suggest for other authority figures, whether it be teachers, coaches, aunt, uncle, grandma, grandpa? How can they be supportive when a teen is dealing with substance use and mental health issues?
Well, for substance...
go ahead.
Go ahead.
You go first.
Well, I was just going to say for the substance abuse issue, and it's probably true for mental health, these other people like teachers, coaches, et cetera, I think one thing that they can do that's really helpful is to reach out and collaborate with parents. How can we help you with this? Because what commonly happens is that the kid is going to the coaches and complaining about parents, and then they are in this kind of become this kind of rescuer of the kid from the parents, which is the exact opposite of what you want to do. We want to understand that ultimately this role of working with this kid that's a parental responsibility and role, and most parents want to do that. They're not perfect trying to screw things up. So, I would encourage them to reach out, talk to parents, say, hey, this is what we're seeing. I'm worried about your kid. What can we do? Can we help you somehow? Just a mere act of supporting them being where you can't be on the team for a week if we find out you're drinking. And we're going to be informing your parents, and they're going to know, and we're all supporting each other. And equally, parents have to support the other provider, the teachers and the coaches as well. So I think it's the adults working together that is the key issue here. So
that's a great point. Yeah. It takes all of the adults being on the same page to be able to handle that. Yeah. Jamie, did you want to add something before I move on to another question?
Oh, nothing. I was just going to agree and also say, I think that, like you talked about in one of your slides earlier, Valerie, that it is helpful in general for kids to feel like they have trusted adults that they can talk to. So, I think coaches, teachers, grandpas, uncles, aunts, everybody, it's always a wonderful resource to kids to just be there to listen. And it's just important to stay clear on, who's the parent and who's the extra adult supporter.
Absolutely, absolutely. We have a question that was submitted ahead of time. It says, I'm in recovery, 15 years sober, and also have depression and an anxiety disorder with which I treat with medication and therapy. Is it appropriate to share my experiences with my teen in order to help them?
I think the short answer is yes, it's appropriate. The nuanced answer is like, it depends what your experiences are, what you want to share with your kid. But I do think that it fits under the broad heading of open communication. That, we get this question a lot from parents, is like, I feel like I'm being a hypocrite if I let them know that I used substances when I was young, or I currently use substances and I'm telling them not to. And so we often just try to encourage families to be as open as possible about it. And, for a parent who is in recovery, that means that they've taken the steps in their life to get substance use out of their life. And that's something valuable. How did they do that? Why did they do that? And that is a resource that's really important and valuable to their kid. It's not necessarily going to, parents, I think, fear that will be similar to like giving permission for kids to experiment or something along those lines. But I don't think that generally it comes across that way to kids, especially if they're focusing on the reasons why they chose not to continue using, the problems that they cause in their life, and they're open to having conversation with their adolescents about it. Some of the risks in talking about it is if the parent comes across as like, so rigid, like, this is wrong, there's nothing that there is to talk about it, and I'm not going to engage in a discussion with you. Those are the kinds of stances that kids start to create more questions around, and if they're already frustrated in the relationship, might want to push those boundaries or rebel, and that might be an easy way to push their parents' buttons, so to speak. So in general, I think it's a good idea to be mostly open. You don't need to share the gory details, and you don't necessarily need to, you want to avoid, romanticizing it. But on the whole, I think it is okay to talk about it. Dad, what's your thoughts on that one?
Well, I agree. I agree with what you're saying, and I think the conversation is not necessarily about the gory details, but I think the focus should be on how their experience of how they overcame this problem. Mm-hmm. That's the purpose of talking to them. Look, I had a problem, and it was hard, and it was a struggle for me, and here's how what I had to do and how I worked my way through it, and how this person's in recovery. They're doing fantastic, and they can tell their journey about how they did it. It's like just being able to be honest and open about what's going on with you, and then trying to get to do something that's going to help you recover from that or deal with that effectively. So I like the emphasis on what they did to make things better.
Okay, excellent. I know we're keeping people over, so we're going to try to get through a couple more questions before we conclude. What do you all think about this strategy? And I've heard this from parents before, maybe even some parents that I know personally, that I want to be the one to introduce substances to my child. I want their first drinking experience to be with me, or their first marijuana experience to be under my household, so I can control the situation. There's a person who asked, what if the parents are using substances with the teenager? How are you supposed to help and intervene in that situation? So those might be two different questions, but kind of along the same line.
No, that's a common question. The different varieties of that question, like people having parties at the house so that they don't prevent drinking and driving and that sort of thing. I think, as a general rule, I think it's a bad idea unless you wait until they're like in some kind of semi-adult state. I mean, it's contradictory of what we're saying. You're a kid and you're not able to manage that stuff. And let's wait until you are, demonstrating some solid maturity and making good decisions. You're living out on your own, that sort of thing, and then we can, if you want to do that, I guess it's okay. But I think until they're adults, the idea of smoking with them or drinking with them is, I think that's a setup. That's not going to be helpful for them. So We want them to see the issue of you got to be in control. This serious thing that you got to be doing. So anyhow, that's my view, but I know there's different ways of looking at this. Jamie, what do you think on this?
I agree that, you know, that's a common thing that we hear a lot from families. And so I think, like, part of why it's not a great idea is that it really does send mixed messages to the kids, and ultimately, relationally, undermines the parents' ability to have that in charge stance with their kids, right? Because what happens if, you know, that's the case, the first drink or the party at the house that feels safer than somewhere else leads to something else. And suddenly now your kid is developing, you know, a larger substance use problem. And their belief is that you're okay with that because you allowed that to happen together, right? So there's just, it like creates a lot of openings that undermines the parents' hierarchy, the family hierarchy. Another just kind of logistical element about that I've experienced with families is that really opens parents up for a lot of liability, particularly if they're caring for other people's kids. You know, if, God forbid, something happened to a kid because they were drinking alcohol or using drugs in a house where the parent was aware of that, then the liability rests on the adult in that situation. There could be criminal charges, civil liability, all of those kinds of things. So I don't recommend doing those kinds of things. To the question of using with your adolescent, I think it's the same concept kind of applies. And so again, it's the mixed message and you know, what are you communicating about the use of substances? What's the age of the kid? There's a lot of variables involved in that. And, you know, one sort of less common but potential risk involved with using with your kids is that depending on the substance and the age of the kid, that could open you up to actually being reported for child abuse. And so depending on the situation, some of those situations could technically fall under child abuse guidelines. And so we don't recommend that in a general sense.
Okay, thank you so much. So once again, we thank you, David and Jamie, for your expertise, for sharing that with us this evening. Thanks to all of you who stayed on a little bit later to go through question and answer. We really do appreciate your time and attention, and we would appreciate it even more if you complete our online survey. It should pop up right as we close, and you will be entered for a chance to win a copy of that workbook by Dr. Amy Saltzman for teens. We have 3 copies. We want to give away each one, so make sure you let us know how your feedback from this program this evening. You can also make a family action plan based on some of the things that were discussed tonight. You can find our free template at familyware.org, and you can also just visit our website to volunteer, learn more, sign up for other webinars, and to donate. Thank you all so much for your attention this evening, and have a wonderful day.